The work that I and others at CHA do is critical to being able to support a population that really has nowhere else to turn. Our immigrant populations, our vulnerable populations here at CHA look to us to take care of them and their needs. And it's through the generous donations of so many and the commitment of a lot of us who work here that we're able to do that.
What I think CHA is trying to do is to understand that our immigrants need high quality primary care, specialty care, medical care. But at the same time, we need to engage with our immigrant populations, understand at a social and structural level a lot of the factors that are influencing their experience in our communities and in their health care. Our work is to speak to those social and structural factors.
We take care of a population with really amazing diversity. Nearly half of the patients we see here in the clinic have moved to Revere from somewhere else. They're from Central America or Brazil or Haiti or Morocco, and bring with them a wide variety of healthcare needs and experiences.
Many people think of immigrants as coming to our country and using medical care and taking healthcare resources from others. And
the truth is actually that immigrants use far fewer public benefits than U.S. citizens. And in fact, a lot of the people that are immigrating to this country are young, healthy, and they work. They actually pay taxes. They don't even necessarily receive the benefits for the taxes. And they also pay into the insurance system and help to subsidize the Medicare pool. If anything, actually, immigrants are subsidizing us.
We can see the ways that poverty, racism, injustice are influencing our patients. And we want ways for us to speak to these more structural issues.
So when you design a program that addresses patients' housing needs when they're being discharged from the hospital, or food insecurity, does the patient get connected to a way of getting food after a hospitalization? Those are things that other hospitals don't typically have to worry about, and they're incredibly expensive and they're incredibly important.
And then we also acknowledge that our patient populations are existing in the context of community. And ultimately, we think that we are the healthcare delivery system interface for creating community health.
We strive to manage not only those health needs that you see in the office, but the ones outside of the office too, because they impact everything. You know, if somebody doesn't have a safe place to go at night, they're not going to worry about taking their insulin every day.
When patients come in for an earache, we're saying, hey, do you ever have to choose between putting food on the table and getting your medications? That's not what they came in for, but we're identifying that.
One of the main things that helps me here the most is that it's that humanistic perspective, and it's very rare that you have that therapeutic alliance between the two of you. It's the helping relationship at its finest.
Philip, he was struggling with a pretty severe substance use disorder. He did all the hard work, but we sort of offered some guidance on where to go and offered him the network and the support to do that. When you get the right care at the right time, that really can make a significant impact on somebody's quality of life.
When I first got sober, I had a lot of unaddressed health problems that I didn't know existed. Scoliosis, fibromyalgia, a lot of pain issues. Anything I've needed, they've helped me with 100%.
Today, he's a student. He's also got a 4.0 at his college, and he's just doing an amazing job.
And it's because of the help from all these different magnificent humanistic clinicians that I was blessed to, that entered my life. Thank you. Because for all intents and purposes, I wasn't meant to live. And with the help I received from Hope House and CHA, I am alive today. And I owe everything I have to both these sources.